Good morning, everybody. Good afternoon, good evening. My name is Sophia Gruskin, and as director of the USC Institute on Inequalities and Global Health, and along with my partners in crime, the Keck Division of Global Emergency Medicine, the USC Price Center for Social Innovation, and the Dornsife Equity Research Institute, it's my great pleasure to welcome you all to this incredibly exciting event. I thought in order to frame the conversation, I'd say something about the genesis of how we all got here. At USC IIGH, we've been working on addressing the impacts of COVID and COVID-related inequalities in LA. In as much as we've been doing COVID-related work in other parts of the world through several projects with the city of LA, and more recently, we've started to work alongside Carnegie Mellon within a framework of just recovery. And this is work that's happening not only here, but in several other cities in the US. In the context of doing that work, we started to learn more about the amazing work that all of the folks on this panel are doing to address inequalities in the context of COVID in LA. And in conversation with several of the people that you're going to meet and talk with here, it became clear that it would be good for us all to know about all of this work, but also that there was something really special happening here at USC with several different research centers and combinations of faculty and students in very different schools. But everybody, I guess I would say, with kind of a similar ethos in how we're tangibly trying to understand and to make a difference here in LA. We're using different kinds of methods, we're working with different sorts of partners, but we're all dealing with the devastating impacts of COVID that we're seeing all around us. And it seemed important to try to move out of our silos, to hear from one another, to share our experience. And I think kind of basically from my perspective, to really think of this as the whole maybe being greater than the sum of its parts. This is really different from what we usually do. And it's my hope that this is going to be exciting and stimulating for everyone in a way that it was for us in trying to put this together. And so the hope is that this session is going to enlighten, but also help give some context and some direction to some of the hard conversations that we're having, but that we really need to keep having around how we're experiencing the pandemic as a city and what recovery could and should look like. Now, obviously with due attention to the longstanding inequities that exist here in LA, and in ways that I hope can be useful to those outside LA, as much as those inside LA in terms of seeing what is and isn't working here. So for our time together, our program is simple. We have a little bit less than an hour where you're gonna meet the teams, and then I've asked each of the teams within 6 minutes to say something about the work that they're doing in terms of the bigger frame, what was done, why, kind of the broader context and the specifics. But our hope isn't to get a handle just on the content of the work, but how this work is done. And we've made a deliberate choice to include not only the PIs on this work, but also students and staff who are doing the work, so that this sort of team effort in terms of what it takes to kind of think like this and work like this is something that we can learn and share together. And there's definitely going to be time for Q&A with the audience, and maybe also for the teams to be able to ask each other questions. One small bit of housekeeping before we start. For the audience, if you have questions, please use the Q&A function on Zoom. We've disabled the chat, and then we'll move those questions into the conversation going forward. So with that, I'd like to start to ask each team if individuals would introduce themselves, and if it's okay, can I start with the Keck Division of Global Emergency Medicine?
Hello, everyone. My name's Parveen Parmer. I'm an emergency physician and the director of the Division of Global Emergency Medicine. I'll pass it on to Todd.
Hi, everybody. My name is Todd Schneeberg. I'm a faculty within the Department of Emergency Medicine and faculty advisor for the Keck Human Rights Clinic. I'll pass it to Emily.
Hi, good morning, everyone. I'm Emily Johnson. I am a fellow at USC and a recent graduate of the Department of Emergency Medicine residency. Molly?
Hi, everyone. I'm Molly Grassini. I'm also a fellow at LA County USC and a recent graduate of the Emergency Medicine residency here.
Fabulous. It's wonderful to see you as a team. Can I turn now to the folks from Price?
Absolutely. Thank you, Sophia. My name is Gary Peener, and I direct the Price Center for Social Innovation here in the Price School of Public Policy. And Josh, can you please introduce yourself?
Yeah, most definitely. Hey, everyone. I'm Joshua Cantong. I'm a research assistant in the Price Center for Social Innovation, and I'm a second-year Master of Public Policy candidate in the Price School. Does that leave Caroline? Oh, we're not doing Caroline.
Uh,
We're doing Caroline.
Okay. Caroline, no Caroline. Okay, no Caroline. Okay. And now, Caroline, go ahead, introduce yourself, please.
Sorry, I'm just a slide runner. Caroline Balla, Executive Director of the Price Center for Social Innovation.
Brilliant. Thank you so much. IIGH, SDG Leadership Academy team, Will.
Hi, everyone. My name is Will Jardell, and I work at the USC Institute on Inequalities in Global Health.
All right. Hi, everyone. My name is Elizabeth Tapia, and I'm a second-year Master Public Health candidate in Keck, and I was also an SDG Fellow this past summer.
Fabulous. Thank you. And Dornsife.
My name is Manuel Pastor. I'm Director of the Equity Research Institute. Our consigna or slogan is Data and Analysis to Power Social Change. And with that, Blanca Ramirez.
Hi everyone, my name is Blanca Ramirez. I'm a graduate research assistant at ERI and also a fifth year in the sociology department here at USC.
Thank you. Thank you. It's fabulous. It's just so exciting, like the different kind of entry points that we all have into doing this sort of work. Okay, so with that, I realize it's short, but it's just to give folks a taste of the kind of work people are doing. If we can hear a bit about the work of each team, and I guess if we can start with the Keck Division of Global Emergency Medicine.
Yes, we're excited to get presenting, and I'll hand it over to Emily and Molly.
All right, I'm gonna share my screen and hopefully you all can see the slides.
Yes.
Okay. So thank you so much for having me. Like I said, I'm a recent graduate from residency and currently a health system science fellow at USC. And for the last couple of years, I've been working with Todd actually on opiate use disorder and expanding services for the patients that come into our emergency department. So when we were asked to talk about recovery from COVID and how kind of structurally vulnerable populations might, still be recovering, we thought that sharing with you all a closer look at the patients who are visiting our safety net emergency departments during the time of COVID would really illustrate how the gaps in our social safety net, directly impacted the structurally vulnerable. So just for some background on kind of what our emergency departments look like at Harbor, UCLA, at LA County USC, and at All of You Medical Center, the patients served by these hospitals are largely Black and brown. They are largely uninsured or publicly insured, and they are disproportionately unhoused. And when we look a little bit closer at the patients who are coming into the ER with opiate-related visits, they are even, greater rates of having housing insecurity and reliant on public social services. So we, like I said, we're in the middle of an effort to expand more comprehensive treatment for patients with opiate use disorder and, giving patients access to medications like buprenorphine for treatment when the pandemic hit Los Angeles. And so like ERs around the country, while we saw our overall visits decrease and patients were avoiding the hospital because of fear of COVID, we noticed we were still getting patients coming in for opiate related concerns. And we wanted to look at kind of how those two epidemics were intersecting. So this is actually an interrupted time series that spans April 2019 to March 2021, with this sort of washout period in March of 2020, where Los Angeles had that first initial big shutdown. And what you can see is, there's this marked sustained increase in opiate-related ER visits after that shutdown. And so when we looked at, the reasons people were coming in, was it for medication refills because they couldn't get to their primary care doctor? Was it because they were having increased overdoses? And actually it was both opiate overdose visits and medication refills for medication-assisted treatment like buprenorphine, both significantly increased post-COVID. And clinically, that really mirrored what we were seeing. Some of the most severe cases of opiate overdose were going on throughout Los Angeles. And unfortunately, though the vaccination rates are, kind of steadily starting to have effects and COVID has become kind of a slow burn in Los Angeles, there has been really a sustained and very troublesome increase in drug overdose deaths in the county. And so, we're continuing to see that there's a real significant impact of those closures post-shutdown. And this is from the Department of Public Health stats. So, what does recovery look like for patients with substance use disorder, with opiate use disorder in Los Angeles? I think it's important to notice that, the suspension of services for the structurally vulnerable patients with opiate use disorder during the initial phases of COVID did potentially lasting harms, right? We're still seeing this really high rate of opiate overdoses and accidental drug overdoses. And so, when we think about cutting off people their usual sources of care, our population that we serve, which is disproportionately Black and Brown and homeless and reliant on social services for support, they were increasingly relying on our emergency departments for those needs. And so, as we kind of start to recover from COVID, we need to remind ourselves that this highlighted these gaps in our system, and making sure that we bolster those services and are ready for the next pandemic or the next period of social strain to support those patients. Thank you. All right.
Thank you. Thank you. Are there more slides from your team? Is that correct?
Yeah, I'm gonna do the slides for Molly. Go ahead, Molly.
Thanks, Em. That was great. Again, my name is Molly Rossini. I'm a Quality Improvement Fellow at LAC, USC, and a recent graduate of the Emergency Medicine residency here, where we work in the jail emergency department in the first floor of our hospital, taking care of justice-related patients from the LA County jail system. Go to my first slide, Em. So for a bit of background, the LA County jail system is the largest in the United States, with an average daily population between 14 to 17,000 on any given day. This year, there have been over 5,000 COVID deaths among the incarcerated population in Los Angeles County, and the LA sheriffs and police departments have also experienced a number of COVID cases within their own departments. And each of the groups of individuals listed on the slide have experienced loss of life among their staff or among the incarcerated population due to COVID this past year. Next slide. Jail systems in California were dangerously overcrowded even prior to the pandemic, and many of them improved their rates of overcrowding throughout this time, secondary to adjustments in arrest rates and in expedited procedures for release of individuals. 10 of the previously overcrowded facilities have improved their rates to remain overcrowded, Los Angeles County being one of them. The LA County jail population did decrease by 30% at the start of the pandemic, but the change was not sustained, and eventually we crept back up towards our pre-pandemic population size, exceeding 100% capacity as it does today, where as of yesterday, the population is 14,897 in LA County jails at present. Next slide, please. COVID vaccine reluctance and refusal exists among both the incarcerated and correctional staff populations alike. Jail patients have expressed vaccine hesitancy related to historical injustices inflicted upon incarcerated populations by the medical community. And understandably, these patients cite these examples as evidence they may get experimented on again, a fear that many of my patients have told me exceeds their fear of the virus itself. Vaccine hesitancy among LA Sheriff's and Police Department workforce has recently become more public after a county vaccine mandate has taken effect. Both of these departments recently report staff vaccination rates significantly lower than the current countywide vaccination rate, which is around 75%. Next slide, please. And individuals in jails have a constitutional right to a speedy trial within 30 to 60 days of arrest, depending on the charge. And making it to court on time is often my patient's utmost priority. They really understand the backlogs in the system and do not want to get wrapped up in it. But court closures and other COVID-related obstacles further delayed already backed up systems this year and have increased the percentage of delayed trials to 41% for patients in LA County jails this year. Last slide, please. The jail environment presents threats to the health, safety, and futures of individuals inside the jail walls. These threats have been present before the pandemic, during the pandemic, and continue to be present afterwards. I think the most important thing, aside from recognizing that the health effects of isolation that we all experienced in the past year are present for these individuals on a daily basis, is also to consider just the environment of the jail itself. We've learned a lot about the conditions of viral spread. The jail being indoors, overcrowded, concentrated with an under-vaccinated population is an ideal environment for viral mutation, spread, and propagation. And for more than just that reason, more than just the empathy that I think we all feel for isolated populations, I think it's important that we encourage ourselves to consider decarceration as a more humane and effective mechanism to improve the health of all in our county. Thank you.
Thank you. Thank you. And thank you to your team for helping us with that. I really appreciate that. I'd like now to broaden out a little bit and move to the IIGH team and turn to Will and ask if you would share your screen so we could hear a little bit about the IIGH work.
Hello, everyone. Again, my name is Will Jardell, and I worked with 4 fabulous student fellows over the summer as their supervisor for the SDG Leadership Academy. This project was done in collaboration with Carnegie Mellon University, and the goal was to build upon the work the Institute has been doing over the past 3 years with the City of Los Angeles to incorporate the United Nations Sustainable Development Goals to a local context. The work we are sharing today is still in progress and analysis is still ongoing. The United Nations Sustainable Development Goals provide a common platform to measure progress at the national and local level on pressing issues. Cities across the world have adopted SDG frameworks to understand progress made at the local level, and additional indicators have been incorporated to better understand the gaps that persist. The COVID-19 pandemic has devastated communities across the world, particularly Black, Indigenous, and communities of color. And as we move the needle toward recovery, we were interested in gaining more information on what is needed to determine the mechanisms necessary for a just recovery in Los Angeles. I will pass it over to Elizabeth Tipia, one of our students, to share more about the work.
Thank you, Will. Hi, everyone. Again, my name is Elizabeth Tapia, and I was one of 4 fellows for the SDG Leadership Academy this past summer. So the objective of our research ultimately was to understand how COVID has impacted social justice indicators as they relate to the SDGs in Los Angeles. This was mainly done through analysis of existing publicly available data, as well as key informant interviews that helped us produce findings and recommendations to help promote a just recovery for all. We analyzed pre-COVID data, as well as current data, qualitative interviews, and COVID-related policies and guidelines. We then collected data on these indicators, conducted interviews with about 15 local community-based organizations, and lastly developed or are in the process of developing a report outlining our findings and pressing issues. Essentially, we did this because we wanted to understand the impacts of COVID, especially on key and vulnerable populations in LA, as well as what data on these indicators was available and whether it accurately reflected these impacts. We also wanted to understand local government and community organizations' abilities to address these issues that had either surfaced or were exacerbated as a result of the pandemic. Next slide, thank you. So we identified 3 buckets that were relevant to the social justice indicators, COVID policies, and to the city of LA. These buckets relate to a just recovery because they cover prominent indicators that are really important to the quality of life of LA residents. So these buckets were basic utilities, which covered indicators such as internet access, water and sanitation, public services, which looked at like access to education, healthcare and transit, and lastly, documents, which assessed access and utilization of various documents such as passports, birth certificates, and property titles. Aside from collecting quantitative data, we did key informant interviews where questions relating to each of these project bucket indicators were asked as long as they corresponded with an organization's mission and programs. And this helped us to understand the real world implications and areas where issues remained not quite captured in the data. So we asked questions such as, what are barriers and facilitators to your organization's ability to address said indicator? And how do you feel the city of LA can take steps towards a just recovery? And so, thank you. And so in our findings, we noted that there were 3 main themes that were reflected across many of the indicators and interviews. First, the digital divide was noted as being a huge barrier for many organizations to adequately address the indicators that they work with. And from this, vulnerable communities continue to be the most left out of having adequate internet access. Secondly, food insecurity was also a theme that was reflected across multiple social justice indicators, with many organizations noting that if they did not normally address food insecurity, but due to the pandemic, they had to adapt to the increased food needs, either by opening a new pantry or further expanding their existing food pantries. And lastly, data collection was a theme that posed many barriers to creating a holistic picture of the extent to which COVID has impacted these indicators. Several of the data points were either outdated or needed to be disaggregated based on key and vulnerable populations in order to help us provide a better understanding of the real world implications on the ground. And so our team developed bucket specific recommendations as seen on the right, as well as general recommendations for all of the work that we did. So for instance, in our recommendations for basic utilities, we noted that internet service providers had traditionally not been incentivized to relay or provide high-speed internet in low-income communities, typically because they know these communities may not typically afford high-speed internet access or products related to that. However, as students did transition online for school or just really other platforms, ISPs do need to be incentivized to lay high-speed internet. In terms of our general recommendations, our first recommendation to the City of LA is to enhance COVID-related data to ensure accuracy in future research, specifically research on these indicators that were analyzed in this project. Considering COVID has disproportionately skewed many of these indicators, new data must be collected that has been adjusted for COVID in order to create an accurate representation. Secondly, we recommend an increase in partnership and collaboration, specifically between community-based organizations and the City of LA in order to implement more relevant programming for vulnerable communities. And lastly, we recommend the city recognizes the intersectionality of these indicators in order to ensure a just recovery. In doing this project, we recognize that a lot of these indicators do intersect in multiple ways. And so as we do move towards a just recovery, we need to make sure that we are not addressing just one indicator, but all of them and how they relate to each other.
Thank you. At the USC Institute on Inequalities and Global Health, we work with global partners and identify Los Angeles as a global city and its ability to provide a roadmap on these issues for other cities. We have a lot to learn from other cities around the world and hope to continue this work to better understand how all cities can move towards a just recovery. Carnegie Mellon University looked at additional cities, including Toronto and Atlanta, all of which have shed new information on what it will take to collect new pieces of data and how data can and should be used. We are at the beginning of this process and are excited to be able to share where we are at with the goal of continuing this work to support and commit to the City of Los Angeles. We look forward to answering any questions that you may have.
Great. Thank you so much. Thank you so much. Can I move now? It's on each one group. I want to say something, but I'm gonna hold myself. Can I move now, Gary, to your group, please?
Absolutely. So again, thank you for having us here to share a little bit about some of the work we're doing on housing instability at the Price Center for Social Innovation. In broad terms, we try to both study and participate in social innovation processes to address complex social problems, and certainly our work on housing stability or housing precarity is one such problem. As most of you know, roughly 60% of the population in Los Angeles County pay more than 30% of their income as rent, and actually almost 30% of the population of our renters pay more than half their income as rent. This is the precarity that was happening before the pandemic. And so one of the issues now in the pandemic was not only did you face that precarity prior, but now there's a lot of people who are accumulating rental arrears or rental debt. Nationally, it's over 1 in 7 renters who are behind on their rent. We see, for instance, that 22% of Black-headed households are likely to be behind in their rent compared to 10% for white-headed households, again, reproducing the inequalities that were already there. We also see that over 22% of renters living with children are behind on rent compared to 10% of renters without children who are behind on rent. And what we've seen in some of our work locally here in Los Angeles and in Riverside County, that either the plurality or majority of households who are applying for rental assistance are those headed by single female heads. So there are really critical gender equity and racial and ethnic equity that have to be addressed. These numbers are large in terms of the number of people who are behind in rent. When you look in California, as you see these numbers on the slide, we're talking about almost 1.7 million people who are behind on rent, about 14% of the population. In LA County, we're talking about around 300,000 people behind on rent with an average debt of roughly $5,000. That accumulates to quite a large number, over $1 billion. Now, we don't have time to talk a lot about what existing rental assistance programs are, that actually exist. But I think it's worth talking about the study that we're doing here with LA County's Department of Consumer and Business Affairs. Next slide, please. So we actually started talking to them about an eviction defense program that they were focusing in on, which ties a little bit into a broader right to counsel conversation to improve the stability of low-income households who are renters here in the city of Los Angeles. Once the pandemic hit, they switched it to an expanded eviction defense program, which had 3 elements: outreach, education, and legal representation to support renters. And what we are doing in this project is conducting a mixed method program evaluation of Stay Housed LA. So we're doing surveys of tenants and landlords, interviews, and then creating a report to evaluate the program. I think what's important about this project is it kind of ties back to kind of how we do research at the Price Center using social innovation frameworks. These frameworks are iterative, they're inclusive, and they are dealing with systemic issues. To that point around being inclusive, on the next slide, you'll see that there are many partners involved in this project. And these projects, include government partners, but they also include people who are on the ground, community organizers, and foundations like the Legal Aid Foundation. What's really exciting about this project is the opportunity to work with Josh Cantong on this project, because before he came to USC, he was working for one such partner. And so I thought I would do a quick Q&A with Josh. And Josh, I was wondering if you could share with our audience a little bit about your work with one of these partners anyway, and with the coalition, and kind of what motivated the coalition to really push for change as it relates to helping people stay stably housed.
Yeah, I really appreciate that, Gary. So as Gary was talking about, I have deep roots with one of the community-based organizations in this kind of CBO, government legal aid partnership that we see behind Stay Housed LA. And the specific organization is SAGE. They're called Strategic Actions for a Just Economy. And so one of the coalitions that SAGE is a part of is the Right to Counsel Coalition. And the purpose of the Right to Counsel Coalition is to codify a civil right to legal representation for tenants facing eviction in Los Angeles. And a lot of research shows that tenants who have legal representation in the eviction process fare off much better in their outcomes. New York City's Universal Right to Counsel program showed that 84% of tenants who had legal representation were able to stay in their homes. So these are really, really important findings. And so I would say that Stay Housed LA is a stepping stone towards that right to counsel, because it provides tenants with, legal representation, as well as it, educating tenants on their rights and outreaching to vulnerable and, eviction-prone geographies.
Thanks, Josh. And so now it was really exciting when Josh came to the Price School's MPP program. We were interviewing RAs for projects, a variety of them, and this being one of them, and to find out that he'd actually worked with one of the partners. So that brought a really unique perspective in terms of the work he had been doing before. But now, Josh, since that you've been on the other side, you helped with the design of the survey, you've helped with some of the collection and some of our very preliminary analysis. What reflections do you have, as a student working on this project, based on now your view from as a research perspective, in addition to a community organizing perspective?
Yeah, that's a really great question. So I think in the work on both sides of the polls, on the policy advocacy and organizing side, and then on the kind of research-based and research institute side, I think what I've seen is that there are kind of multiple ways to press for change and to advocate for the creation of progressive social policy. And I think that the research center, the organizers, the activists, et cetera, and the government agencies are all kind of tied in this like shared network. And in my perspective, I think that movements are the ones who kind of press and make contentions against the state to expand and to provide social protection measures. And then the state provides an infrastructure and grants funding or concessions, whatever, for whatever policies result from the organizing. And then I think the research institutes, the research base creates an analysis of the findings of a given policy and then allow it to be generalizable and kind of extended to other jurisdictions in the process. But I think what I've seen ultimately is what kind of ties back to something that Dr. Pastor had said recently in relation to the connection between power, policy, and research, and how essential all three of those elements are for creating social change in this world that direly needs it.
Thanks, Josh. So just to conclude on this particular topic of work that we're doing, I think what we've seen in this work and other work of the Price Center is that there really is some of the power, if you will, is just pushing to make sure that the pandemic doesn't make things worse. And then if that goal is accomplished, then they feel almost satisfied with the strength of the program or whatever the intervention might be. But as we know, we had an unjust economy prior to the pandemic. And so it's really incumbent upon all of us who are working in these spaces to point a target not to where we were before the pandemic, but to point a target to where we need to go in this year and beyond. So with that, happy to turn it over to the next team.
Thank you. Much, much appreciated. Manuel, can we turn it over to you and your team? You're muted though.
Thank you for reminding me that it's only been 18 months. And let me just share a screen and a PowerPoint. It's this one. And so I want to talk about a project actually that got completed, as you can see from the date there, in September 2020. And it actually started at the end of March 2020, when we sort of began to realize that the COVID pandemic was the disease that revealed our illnesses as a society, the precarity of employment, the racial wealth gap that meant that so many people didn't have a cushion, felt like they needed to get back to work, the inequities in health access, and the challenges with people who lacked legal status in the country, but yet were long-term residents and deserved support, but weren't going to get it. And as we were thinking about those issues, we were approached by 5 different foundations and suggested to them working with UCLA because anything that involved a collaboration between UCLA and USC would get a lot of notice. And the collaboration evolved into this report, No Going Back. And the idea behind the title was that particularly in spring and summer of last year, people were talking about recovery. But why would you want to recover, in a way, as Carrie was pointing to a normal that never really worked? So how do you instead reimagine and restructure? And in doing that, taking into account the tremendous inequalities that emerged during COVID in terms of the much higher death rates for Pacific Islanders, Latinos, and African Americans, and also the much lower vaccination rates that emerged when the vaccinations evolved. So what we did in this report, which was sort of interesting, was substantive and procedural. Substantively, we pointed to issues like undocumented immigrants in Los Angeles. And what you'll see here is that LA County has about 800,000 undocumented Angelinos, people who've been here for a pretty long time who live here, but they're more than matched by their US citizen family members who live with them and their green card holder family members who live with them. And so when the federal government in the initial CARES Act excluded mixed status families from being able to access aid, they were cutting off nearly 1/5 of the Angelino families in Los Angeles County. So substantively, we pointed to a lot of things like that. Procedurally, what was interesting was that we worked with a steering committee of about 20 community leaders. And we actually went through an education process with them about a variety of different issues to try to create an intersectional understanding of the racist and classist dimensions that were being revealed by the COVID crisis. We also worked with about 20 faculty members and about 20 graduate students. And that was pretty hard to manage from one of the star graduate students of that process, Blanca Ramirez. Blanca.
Hi, everyone. I had the privilege of working on the immigration nonprofits and Black LA sections of the report. And one of the things about working with this particular project was not only, as Manuel mentioned, that there were so many authors on the project, and we had the steering committee, but also we were on a tight deadline of wanting to get this project out and wanting to see it in the world making a difference. And I think another really important thing that emerged collectively for us as a team is that we wanted for this project to be engaged with the people that were working on these issues on the ground and working and having this project uplift their voices. So in that context, it made the project pretty challenging, but at the same time, incredibly rewarding, because we were working on bringing timely solutions, balance between the research and the experts that were working on these issues on the ground. And when I think back about this project and being a graduate research assistant on this project, I think the word that comes to mind for me is humility, the humility of a researcher of entering even familiar literature. Like I'm an immigration scholar, and I can tell you the theories, the jargon, but that's not going to be of utility for a project that must speak to multiple stakeholders. And so there's a humility that comes in learning to make your writing accessible and clear for people that may not have time to like sit through and sift through theories. And then the second thing about humility is, I think, as Manuel also has a saying, that numbers can only take us so far, but really the stories of people are part of what's going to be the convincing narrative. And for this project, I wasn't involved in the interviews per se, but I got the chance to read the transcripts of the focus groups and the individual interviews, and we were able to link those narratives into our report. And I think that is also what took this project farther. Sure, we can talk about the numbers of undocumented immigrants in LA, like Manuel mentioned, in 1/5, but when we read a story about undocumented people being left out of the CARES Act, that might hit harder or differently among some individuals. But overall, I just wanted to wrap up by saying that participating in this project was a little tough for those things mentioned, but it was incredibly rewarding to respond to an issue that was so pressing and so overpowering at the time, but using our writing and our research to elevate different voices was such an incredibly rewarding experience of my graduate career here.
Fantastic. Thank you. There's so much here. I mean, I have to say, it's just all so deep. There's just so much to do. It's really just like, in terms of just hearing everything. I think one small piece of housekeeping, please, for the audience. If you have questions, please do use the Q&A function on Zoom. We're going to curate those questions. I'm going to take the chair's prerogative and ask each of the teams a couple of questions as other questions come in. And I guess I'd like to ask each team really what you found most surprising in terms of the way of doing this work and about your findings. Like if there's something like what was most surprising about this, and who wants to start? I can start calling on people randomly if you like, if that's the best way to do it. Okay, all right, we're gonna go in order. Okay, Parveen, your team.
Sure. I think, well, I'd like to give the speakers a chance to respond to that question. Molly and Emily, do either of you have any, because you've been embedded in this work, do you have any thoughts on what sort of surprised you the most as you started to explore these issues? Maybe Emily, you could start first with the substance use disorder and COVID.
Sure. Sorry, my video is having some trouble, but I think we really, I was pretty shocked actually to see, when we had empty waiting rooms with COVID starting and people really avoiding the hospital, we were really seeing this just like very marked increase in patients who were relying on us for their for all of their care, both those kind of, like I said, those kind of routine refills, and then also for these really severe overdoses. And so, it was really like a testament to the fact that like the fear of COVID was not matched to the need for, healthcare services during this time. And there were really no options for people who were reliant on kind of the safety net clinics and some of those other services. When those things dried up and when they were suspended, like the ER was kind of like that last refuge. And so I think, if we were to look into this further in other times of kind of social strain, we will probably see similar increases in, visits to the ER for patients who kind of are reliant on their social safety net. And I just, moving forward as we try to recover, I feel like that's this is a warning sign that this is what will happen if we don't bolster the services available to everybody.
Yeah. Thank you for that, Emily. And Molly, I should say, Molly and I actually worked on some research looking at deaths in ICE detention as well. And Molly was the first author in one of our first papers on that. And so Molly, I wonder if you have something to say about what surprised you. And then also I'm curious to hear if there's any parallels to what we did with the deaths in detention work with the issues you've seen in our own jail population.
Yeah, thank you. I think what has surprised me the most, although maybe it shouldn't, is as the pandemic sort of started seeing that everything was so slapdash, it sort of felt like implicitly like we should have something in place. This has got to be something. This has happened historically multiple times, incarcerated populations, viruses. We have a very strong understanding of how this works. We have something in place, right? But everyone was strained, and it was surprising and a little bit disconcerting to see how kind of the system was just putting itself together in real time. And not necessarily surprising, but saddening and frustrating to understand from the perspectives of the jail patients, their reluctance to be, on board for something that even populations that had a strong history of medical experimentation, without their consent, were reluctant to take to some degree as well. So, and watching that play out in real time has been surprising, interesting, and frustrating. I mean, as far as our findings among the ICE detention population, they do all mirror one another. The jail setting is sort of a microcosm for the detention setting. The numbers only increase, and the data only becomes harder to find as the system expands. So that's been difficult as well.
Thank you. Thanks. Can I turn to Will and Elizabeth for any reflections you might have?
Sure, I can quickly share. I think the most surprising thing from my perspective was how intense the digital divide had impacted so many things. I think it was celebrated that people were gaining free access to internet. However, a lot of individuals didn't have access to high quality internet to where they could actually have Zoom work on their device. And in the same way, they also didn't have access to devices to be able to use Zoom or use other platforms to work from home or to go to school. So I think a lot of organizations that we spoke with shared about the digital divide, which was something that was surprising. It shouldn't have been surprising to us, but I think that it kind of shocked us at the beginning.
Thanks. Elizabeth, anything to add?
Really, just to echo Will, I think the digital divide and just seeing how internet access came across in so many of the different indicators we looked at, not just like, I only thought of it really in terms of like education at first, like, oh yeah, going online for school, but then seeing, of course, like healthcare, like so many other aspects of it that were really prominent in being able to like go through your day-to-day life now. It really did surprise me.
Thanks, I appreciate that. Josh, Gary.
Yeah, I'll just say one thing. It's difficult to do qualitative work during the pandemic, and we felt like there was actually even more barriers than some of the other work that we were doing. What I was surprised by is the fact that, our target populations for how many surveys we wanted to have completed and so forth actually kind of blew through those numbers. We were hoping to get 400, and we didn't have the ability to use our normal tools and approaches to get those 400, but we had almost 600 people respond, tenants. And while they are getting, an appropriate compensation to fill out a survey, I don't think that was the driver. I think people wanted to tell their story, to share, this is what's happening. We did a similar kind of survey to renters, I'm sorry, to tenants. No, I'll say it correctly now, the landlords. And, you know, I just found out we have almost 150 responses just within weeks. And again, you wouldn't, and they're not getting financial incentives to participate, that they want to share what's happening in our system. That shows that, in my mind, again, that the system isn't working for really anyone. And, you know, it's, you know, exciting for us, but also humbling, as Bianca said, to be part of trying to contribute to helping to create a system that is going to work for people.
Thanks. Josh, anything to add?
Yeah, I want to touch on kind of the digital divide issue piece that Will talked about earlier. I think that a lot of tenants, low-income tenants of color and disadvantaged geographies, maybe tenants who are older, maybe tenants who might have a disability, are put at a really huge disadvantage when getting the benefits of, say, rental relief. And so I've just been thinking about that, how, you know, on one side, we have this, you know, survey to outreach to tenants to gauge their experiences. And on the other side, we have tenants who are trying to get aid to stay within their homes. And both are kind of a part of the same network that gets at this digital divide issue that plays in a lot on the matter of like inequality, racial and spatial inequality that we have in Los Angeles and beyond.
100%, totally hear you. Blanca, Manuel.
Blanca, go first.
I think one of the things that surprised me the most, and Josh, who is in our department, says the suffering is concentrated at the bottom, was just how undocumented immigrants were being fired from their industry or being let go, and it was disproportionately undocumented immigrants, or immigrants in general in the industries that they were in. And so that to me was really surprising, how disadvantage just accumulates. Yeah.
So I'll do two positive surprises in the same vein, which is I was surprised that our data on undocumented immigrants and mixed status families got picked up so much and utilized in Los Angeles to launch an Angelino Fund to provide cash assistance to undocumented Angelinos, and as the basis for immigrant rights groups to get the governor to agree to $75 million in state funding that would go to undocumented immigrants, and golden stimulus checks that would go to anybody who filed with a individual taxpayer identification number rather than a social security number. So the power of the research to do that. And another instance of this that was, I guess, particularly rewarding, I was in the governor's task force on jobs and business recovery, and I kept talking about how this was going to ravage immigrant Latino communities. You could see it was going to happen. And when it finally started happening in a really big way in the summer of 2020, I remember really throwing kind of a fit in one of those meetings about how much effing louder would I need to shout for you to pay attention to what was inevitable. And a week after that, the governor's public health department unveiled the health equity metric, which required that you could only move into the tiers of reopening if you got testing positivity rates in the lowest quartile of census tracts to match the county average. And then they used the health equity metric also to pump vaccines out. So for those of us who think our research is never going to be heard, it might take a little screaming, but a good scream, lots of community organizing and power, and well-placed data can make a difference.
Love it. I totally got you. Totally got you there. You know, I want to ask kind of a huge question to you all, and I, you know, you can take it however you want to take it, but you know, you've heard from each other. You're living it. We're all living it. You know, if we really want to move towards a just recovery here in LA, what are the key issues we need to be working on, right? What do we really need to focus on? And you know, are there opportunities for synergies in terms of what we're all doing, whether on the research side, on the education side, on the advocacy side? Or are there things that you've heard that you feel like, okay, this is a way we need to think about things moving forward? And I can go in the same order as before, if that works for folks, to do that. And I'm just going to call Todd, I'm going to call on you because you haven't spoken. So go for it.
Sure. It's a huge question. I'll try to give my 5,000-foot view. I mean, I think these situations and what we're talking about and a lot of the things we're seeing in the emergency department are kind of emblematic of the structural vulnerability of our populations in our society, and these compounding precarity among our most vulnerable patients' lives of these different intersectional problems. And bottom line is that our current systems of safety nets and mutual support are vastly insufficient. And we're going to need to think about how we deconstruct our resource and access hierarchies in a way that enhances health and, more importantly, enhances and with respect to justice, rather than the way they're currently set up. And it's not going to be through emergency care that these problems get solved, because we have to go much further upstream than where we are.
Thanks. Totally. Anyone else on that team? I'm dividing you by team. Anybody else on this team? Molly, Emily, Harveen, you're good?
Todd said it perfectly, I think. Yeah.
Okay. All right. Okay. Will, Elizabeth.
Yeah, I think the importance of qualitative data came through a lot in what we were doing. I think numbers were great and provided a very good base, but I think listening and talking to NGOs about what was actually happening to populations provided a massive insight that I don't think the data showed based off of COVID. I also think that the idea that everything intersects in huge ways is something that this event and all of us talking together really brings positive, because we can learn from each other and use it to kind of make impacts. There's things that all of you are sharing that impact what we did for our project that we probably didn't think about, and I hope vice versa. I think the intersectionality of all of these things is something that is super important and can bring us all together, and all of this is really important work.
Thanks. Elizabeth?
Yeah, I think to move towards just recovery, we really do need to reassess what accessibility looks like, or I guess adequate accessibility. Because in our finding or in our research, there were a lot of like statistics that showed, like 100% access or really high levels of access to different things. And then in our actual like findings and interviews, we learned that wasn't the case. It wasn't a truly adequate form of access. For example, with the internet service providers, I think in our research, we found a really high level of like internet access, like near 100, a really high level. But in breaking that down, we know that's not really the case when you look at like race or ethnicity or like gender breakdowns. So yeah.
Thanks. Super helpful. Totally. Josh, Gary.
Josh, do you want to start?
For sure. Okay. Yeah, that's a huge question. I'll just make it nice and fast. I come from the community-based organization coalition perspective. When it comes to assessing the huge implications of like our massive rental debt crisis, I say that we need to empower tenants and fill in that gap and difference of power between landlords and tenants by providing tenants with a fully codified right to counsel. And I also think that, I personally think that, we need to find a way, a program and infrastructure to get rent relief into tenants' hands, or to have a non-means tested removal of rent debt. So that's what's been on my mind a lot, assessing the nature of debt and racial injustice and matters like that.
Thanks, Josh. I think that this has pointed a laser focus that we need to deal with systemic issues, so that there's many of us who are working on different quote unquote issue areas, but the same systemic issues lead to health disparities that lead to housing insecurity. And I think that going forward, we can't achieve a just economy without understanding and dealing directly with those systemic issues. And I think we're learning even more so, or confirming in some ways, that the way that we have to do that is through an inclusive and iterative process, And not that we try one thing once as an intervention and go, well, that didn't work for that population who have been systemically oppressed, so we give up. We wouldn't do that in other circumstances where we're trying to innovate. And so I think that we have to create a different mindset about how to get to deal with these systemic issues. And certainly social movements have pointed out, a great model for how that's happened in the past. But I think that sort of ethos needs to spread much more widely in the way we try to address these problems.
100%, 100%. Blanca Manuel.
Okay, you first.
I think I second what a lot of you have said, that these issues are systemic and intersectional. And even when we were focusing on the undocumented immigrant community, even then, like other issues intersected, like Indigenous migrants, Black migrants, and making sure not to take all of it into account.
So the thing I would add is there's a phrase in our report that someone else wrote, and I keep saying now, and it was about thinking about communities that are left behind and kept behind. We too often, when we see quote unquote disadvantage, call it disadvantage rather than calling it structural disempowerment. And I think when we look at the inequalities, we often think, well, that's a bug, when in fact it's a feature of the system. And so I think thinking through that a just recovery isn't trying to prevent mistakes from happening, but trying to really rewire the system so that it's more structurally just from the get-go is really crucial. And I would be remiss if I didn't add, it's also with Gary and his center worked on this report with us. We've been able to do some great stuff with Parveen, particularly on the detention piece, where she's just led with our team fantastic work on that. So I think another thing I certainly pulled away from this period, which I've known for a long time, is that I do my best work with other people, and we can all do our best work in collaboration.
Thank you. Thanks. Yeah, totally. 100%. Yeah, 100%. I mean, there's one last question I'm gonna open up to anybody that's come in through the Q&A. And I just would like some really quick responses to this, if I could, before closing up, which is, this has all been super useful in terms of what it means for our work and our research, but what does it mean for the classroom? How can our teaching evolve to take all of this into account? And just quick reactions, and anybody. All right, I'm going to do it again. I'll start calling on people, so I can start doing it. Okay, Parveen, go.
That's great. I was going to jump in anyway. I think that I mean, I agree. I think the natural inclination with academics is to narrow and silo, and we do our best to collaborate. But I would love to just see, I would love to see formal inclusion of sort of a broader viewpoint, a broader set as we teach. And I think it takes a little bit of uphill walking to sort of make that case in different circles. But certainly teaching emergency medicine residents about the work happening at that Dr. Painter and Dr. Pastor are doing would be fantastic. I'd just love to see more of that. So we all have a responsibility, I think, to do that.
Anyone else want to throw something in?
I will, because I've got two of my students here, Blanca and Josh, and they've both experienced me saying, you only have 3 sentences to describe your ideas, and please do not use multisyllabic words. So learning to articulate, and Blanca pointed this out, learning to articulate clearly. We teach our grad students often to get really complex and theoretical. They need those skills, but they need to be able to explain things clearly and simply to have an impact on the world.
Totally. Anybody else? Final thought on this? Okay. All right. I really want to thank everybody. I think that was incredibly thought-provoking. I hope you all found it incredibly useful as I did. I want to thank each of the teams for your good humor, for your willingness to substantively engage in this. But I guess for the students that are listening, I'd like you to consider this a call to action. Please do check out the wonderful work that folks are doing, but think about your role in terms of what it means to help move our city forward. Thank you, everybody, for the wonderful, provocative interventions. I really want to thank Michelle and our team who worked behind the scenes to really make this happen. Thank you, everybody. Please visit websites, follow us all to learn more about our work, but I really hope we see this as an opportunity for us to be able to keep working together. Thank you very much. Thank you all.